This is Dr. 𝐦𝐨𝐬𝐤𝐞 at Angelic Wellness. We are going to be talking today about the different forms of hormone replacement therapy. When I say forms, what I mean is the route of administration, meaning how do you put the hormones in your body and why is that important, okay? If that's of interest to you, click that subscribe button, click that notification bell, and join my secret VIP free group in the school app. That's where I go deeper into these topics. I'm able to talk about things that I'm not able to talk about on YouTube, and let's go. Today, I am going to share with you the different forms of hormone replacement therapy and why the way that you're prescribed the hormones matter. So, hormones can reach your body by applying it on the skin as a cream. You can also put it on as a patch, right? As tablets that we dissolve under our tongue, we call sublingual, as a pill that we swallow. We can inject hormones into our tissue, into the muscle. We can also take hormones by putting it under the skin in the form of what we call a pellet. There are even nasal sprays as ways of giving hormones to the body, okay? So hormones are made of fatty substance. Usually the backbone of hormones is from cholesterol. Yep, you heard me right, cholesterol. So cholesterol is the actual main ingredient that the body takes and turns into different hormones in your body. And a lot of people don't realize that sometimes actually taking medications that lower your cholesterol can also lower your hormone levels. I know, I said it. We can get into that a little bit more in our secret VIP group. If you haven't joined, you better join, because that topic we cannot discuss all of that on YouTube, okay? But honestly, your body needs cholesterol to make hormones. So the backbone, being cholesterol, goes through different pathways and enzymes, okay, and reactions that then turns that cholesterol into the main hormone we call pregnenolone. From pregnenolone, we then make progesterone. Then from there, we can also make testosterone. From there, we can also make estrogen. From there, we can also make cortisol. From there, we can make DHEA, and the list goes on and on, okay? What you need to understand is that because they are fatty substances, they can be absorbed into our body in multiple different ways. So science has advanced to where we've come up with different ways of delivering this medicine to your body. And this makes it convenient for different scenarios, right? So for the person that doesn't like to swallow pills, hey, we got creams, we got patch, we got injections, we got pellets. For the person that's scared of the needle, well, we got orals, we got sprays, so these different formulations allow your doctor options to provide you with what's most convenient for you, what's most appropriate for your scenario, and make that informed decision. So for example, when I have a couple comes to see me and they need hormone replacement, I'm also keeping that in mind that, okay, if I give this woman estrogen cream and she's at home with her spouse, is some of that estrogen cream going to rub on him? I have to make that decision before I make that choice, because if he doesn't need any estrogen, I don't want any of her estrogen to rub on him. And vice versa, if I was treating him and he needs to boost his testosterone level and we decide to go with a testosterone cream or gel, well, guess what? Some of that might start rubbing off on her. So for that reason, I might choose not to use a cream in that scenario, even though it might be a nice option for that patient at that time, but I have to consider the environment in which it's going to be used. And so I might choose not to use a cream. I would then say, okay, my option in this case, for this reason, is maybe an injection, maybe sublingual, so that we can dissolve it under the tongue and not rub it on anybody. Okay, hope that makes sense. So we make that decision during our consultation to figure out what is going to be the best option for you, considering all these different things. So sometimes patients will ask me, Dr. O, just give me the most effective one, because I'm tired of feeling this way. I just want to get back to, feeling like myself. All these benefits that you mentioned, I would love to have those back. So just give me the most effective one. And the truth is, the most effective one is something that we have to find by trial and error. Because here's what has to happen. Before we even start any type of hormone replacement therapy, we have to test. So be wary of providers that start to prescribe you hormones without checking your levels. Why? Because yes, your symptoms can give me a clue as to what's going on, right? For example, if I have someone that is having night sweats, automatically I know if it's not from infection or tuberculosis or some other, weird condition, I'm almost going to assume that that person's testosterone is low. So because of that, I'm going to go, okay, well, let's check your levels. Let me confirm my suspicion. And once I see that it is low in the blood, before I start any therapy, okay? So we do have to have blood work. And so once we get the blood work, now we know also how severe it is, because that will also determine how much hormone to give. And when we need to monitor it later to see if what we're doing is effective, we have a reference point, right? So we look at the baseline, where you're starting at, before we recommend the treatment option, and then we have to test afterwards to see if it's improved. So if you haven't watched some of my videos that I talked about in the beginning, explaining what hormones are, I talked about this couple of compounds called FSH and LH, which were chemical messengers that the brain releases to tell your body when to release testosterone, when to release estrogen. Those are some of the things that we're testing for in the blood to see whether the brain is sensing if there is enough hormones or not. So even as we're treating, we're continuing to follow these hormone levels to see whether they're rising, dropping, and that is letting us know if we've given enough hormones, if we need to give more, if we need to give less. So I don't subscribe to the idea that, oh, well, you're at menopause, here's some estrogen. What if you don't need estrogen? Because sometimes I've tested women way past menopause and their estrogen level is still fine. Why? Because, well, the ovary is not the only place women get estrogen from. We can make estrogen from DHEA, which comes from our adrenal gland. We can make estrogen from fat cells. So yeah, for my overweight patients, sometimes I will see estrogen levels really, really high. And they're in menopause. So, do I need to replace estrogen in that patient? No. I'm not going to give her estrogen. She's still getting plenty from her fat cell. We need to work on getting some fat out of her, but we're not going to give her estrogen. So, those are the reasons why testing is first. We've got to test, we got to know where you are, and then we recommend the best option for you. So, there's no such thing as one method is better than the other, okay? Don't let anyone sell you pellets and say pellets the only way, or cream is the only way, or pill is the only way. We have to take each individual patient and look at their risk and their family history, their symptoms, their financial situation, whether their insurance is going to pay for some of this stuff, right? And then come up with a treatment plan. So this is a tailored medicine. This is not everybody gets the same pill, everybody gets the same pellet. No, it is individualized. And that's what I want you to take home. So if anybody is pushing one specific method and only one method, I'll just say beware. See you on the next one. Subscribe.